Okay, good evening, everyone. Welcome to tonight's meeting of the Scrutiny Health and Social Care Group. Just go through the admin first. The meeting's being live streamed, and a recording of that live stream will be available on the Council's website within 24 hours of the meeting. If remote participants can use the hands up icon on your screen for questions. Turn your camera and microphone on when speaking and off when finished. With members and officers in the room, please remember to switch the microphone on when speaking and off when I have finished speaking, and speak directly into the microphone. Okay, please switch off mobile phones or place on silent mode. Okay, it's the agenda. Item 1, apologies for absence.
None, Chair.
Thank you. First, everyone's had a chance to read the minutes of the last meeting. Are there any comments, or are those okay? Okay. Any disclosures of interest?
None that I'm aware of, Chair.
Cool. Any urgent business?
None, Chair.
Thank you. Any references from committees or other bodies?
Again, none, Chair.
Thank you. I have nothing to report on since the last meeting. So we're going to item number 7, reference from the Executive, 24th July 2023, about the request from the Executive to ask us to investigate if the planning and licensing legislation can be used to tackle the obesity crisis in reference to takeaway outlets.
So this report is before members for you to consider a recommendation from the Executive in relation to obesity. This came out of the Executive meeting held on 24th July, where the Executive considered a report on the healthier food and drink advertising policy. The Executive were minded to agree on an additional recommendation, which said that the Overview and Scrutiny Board be requested to look at this. However, on further consideration, it appeared more appropriate to ask this group. So members are asked to consider the recommendation from the Executive set out at paragraph 8 of this report, and if minded to take the Executive's request further, to indicate how members wish to approach the matter.
Thank you. So if we can have people's opinions on whether we should be minded to take the Executive's request further, and if so, how we would want to approach that. Okay, Councillor Hussain.
Yeah, I mean, first of all, it's nice of the Executive to ask the board to look at the number of takeaways, but I think, may I, and this ought to be minuted, I don't know how we can send the message. You know, the Health and Social Care Review Group does of course, you know, not only accept the recommendation of the Executive, but so the Overview and Scrutiny Board, but also remind the Executive that this is something that they have agreed about 6 or 7 years ago, where they were given a task. They instructed the Planning Department to be able to look at the all the takeaways and places from so close to the schools, that they ought to be looking at it and put in as a policy that no takeaways or a similar establishment should be given a planning permission. And that paper hasn't been. Now they haven't even implemented it. So I would ask that, you know, they need to take their responsibility and implement what they had instructed the Chief Executive specifically to do, and hasn't been done as yet.
Okay, thank you for that. I agree with much of what you said. With conversations I've had with Democratic Services, we think it would be a good idea if the first thing that happened is if officers responsible for planning and licensing came to us with a report detailing the situation as it is now and the steps that have been taken so far, so that we can have an idea of where we are now and what steps have been taken or haven't been taken since 2016, 2017. If we had a report detailing that to start off with, then we can work from there.
But I'm saying, Chair, and without having to go over it again, welcome as it is, but it needs to be emphasized that two needs to go together. It's no use agreeing to have a look how many takeaways we got, but every day, every month, every week, there are new establishments are opening and getting a planning permission. Unless we get our acts together as a one council, we are not going to succeed. Counting the how many takeaways isn't going to improve in terms of the issues that we are dealing with.
Okay, so how would you, so you would like to go back to the executive and say,
Like to make a recommendation from Overview and Scrutiny Board that we need to be working with all the parts of the council, not only that asking the Overview and Scrutiny Board to look at it in terms of also where the local authority as a licensing and the planning authority does issue licenses and plannings to the takeaways closer to where the schools are, that need to be taken into in this what they are asking the Overview and Scrutiny Board. That's what I'm asking for, and I'm sure the officers will get the right wording for it.
Councillor Riles?
So I was just going to say, I agree with Councillor Hussain for this section. That's not me. Okay, I was just going to say, I agree with what Councillor Hussain has said. Okay, thank you.
Thank you.
Yeah, I also agree with that. Thank you.
Okay, we can go back to the executive and ask them to play their part in this process. Well, I think we should also implement what the recommendation that they've passed on to us. Does anyone else have any other comments or questions? I don't know if I don't think we need a formal motion to proceed with this. We just sorry. Yeah. Okay. Yeah. Okay. So we are minded then to take the executive's request further. We now have, if anyone has any ideas on how we would wish to approach the matter. In that case, I suggest that we ask the officers responsible for the licensing planning process to produce an initial report detailing the situation as it is now. And following on from that, a report about how the the licensing process can be used to regulate takeaway food outlets, and the practicality and the potential of using that legislation. And hopefully from the first part of that process, then it should become obvious about the practicality of using the licensing and planning legislation to introduce consideration of health into the planning process. So hopefully this can be done quite quickly, and if it can be done, it should be done with some urgency, I think, so if we can emphasise that. Thank you. Is there anything else that we need to? Thank you. Okay. We'll go on to item 8, the Public Health Intelligence Update, JSNA overview. Sally.
Thank you. So that hold on 2 seconds. Can you get time? Sorry, disturbed by my child. Apologies. So the paper is in your pack. So this is an update on the Joint Strategic Needs Assessment. So we've just expanded it slightly this year to try and align it much more to how we monitor progress against our 2040 ambition. So just expanded it to be much more aligned with the 5 areas across the 2040 strategic vision. So not only has it got the health indicators across the life course within there, so looking at start well, live well and age well, but then also, and previous years it has had broad demographic information as well as some of the wider determinants of health, but this has been much more strongly built in now to read across to the 2040 strategic ambitions. So there's a section around fairness, equality and local pride, a section on net zero, and a section on child-friendly town, and then it leads into the start well, live well and age well sections. And then at the beginning, there's also the broad demographic information that gives a really robust story of the population of Luton in the This is Luton section on page 12. It also gives a very brief summary of some work we've been doing, led by the intelligence team, on a social progress index, which gives an indication across the borough on various measures and enables a ward comparator. So we will use this going forward as well, much more in terms of monitoring progress against 2040. So the JSNA this time gives a lot of detailed information, and I'm not going to go through all of the pages in detail, but I'll open up to questions shortly. But it gives a lot more detailed information across the life course and across 2040, and provides the evidence base which will inform our annual progress reports against 2040. So we're trying to get the timing much better aligned to enable us to monitor that progress. So it gives the base, strong evidence base to move forward across us developing our services and strategic plans over the next year. So I'll pause there and open up to any questions.
Thank you, Sally. Yeah, thanks to you and your team for producing the JSNA. It's obviously vital that any plan or strategy to improve health needs to be backed up by the data. It's also good to see that you're working on gathering data to address and better understand structural inequalities, which obviously backs up the Marmot Town work and the 2040 process in tackling health inequalities. Let's open this out. Does anyone have any questions or comments? Councillor Hussain.
First of all, can I thank that, the report itself is JSNA is very comprehensive, and, it gives a huge amount of information. I try to absorb as much as I possibly can, but I think I would need to have an Einstein brain to be able to remember every line of it. So really, but first of all, thanking Sally for that. What would be very helpful and would have been very helpful if, for members' sake, if we could have had a report in 5 or 6 pages, which had given where we have made a progress, where we are not doing so good, and what is the reasoning behind it. And I find that, that in every headline figure that I've read, either I've got it completely wrong, please remind me, Sally, if you would, is that we seem to be going down rather than upwards in terms of our determined in improvement of our health, be that may life expectancy, be that may obesity, be that may screening, the list goes on and on, where we are far below of any of our strategic neighbours or SIFA neighbours, or whichever way you look at it. So if we are talking about, the 2040, we need to have making a very progress, because the figures I've looked at, and there is a number of reports, and I've just read only the headlines, and I'm not giving you a long and a speech or anything like that. We got a Denny's report, which tells us a warning, very serious warning, that in terms of men's life expectancy has gone down by 8 years. I thought the gap was getting better, but it's gone down again. So can you please be specific? What is it that you can recommend as a director of public health, which we ought to be concentrating as our number 5 priorities that we need to make a progress on? Or you can point to me in the report in all these pages where we have made a significant difference in terms of improvement of public health.
Thank you. So in answer to the first point, which was just around it's a huge document, it completely is a huge document, and the team are working on some short versions. So we've got an executive summary, but looking at some short versions on different themes. So some around different topic-based themes, or around the Start Well agenda, or one of the 5 priority areas for 2040, and across the different themes. So having sort of a short version for across different themes, and some of the where we're progressing, where we're not progressing, and where we need to focus more. So that is in progress. I do appreciate it is a lot to digest, but the idea is not that people are expected to remember it all, but that it's a resource document, so people can go in and pull out the right information when they need it, at the time that they need it, and go back to it and keep referring back to it. So that's the idea, that it gives that source of information on lots of different indicators that we can then use to inform work. So it will be online on the Luton Observatory and be able to be downloaded by people for when they need the right information. In terms of trends, unfortunately, you are right that we are going in the wrong direction for a lot of the indicators. But for a lot of those, we're following the national trend as well. So obesity, you mentioned, obesity rates are increasing nationally, and we are unfortunately also increasing in our rates of obesity. Stop smoking, smoking rates are going down. So we've seen some good progress there, and that follows the national trend, but we are doing well for smoking prevalence in Luton. Screening, I think you mentioned, we aren't doing so well and needs more work. So there's a lot in there, and a lot of points highlighted where we need to do more and maintain that focus. It's a difficult climate. We're come out of COVID and cost of living, and it's some of these things that we're talking about are really hard to turn around. So a lot of the work that we're doing is a lot of that long-term collaborative work, where we're really trying to maintain the focus on issues and buck that trend. So in terms of saying 5 top things, so this report isn't just public health action, so it's across the whole, not even things that only the council should be working on. So obviously the healthcare system, NHS will be working on some of these indicators with us, and wider colleagues across the voluntary sector, across police. So there's a lot of measures in there that aren't just council. So they're wider than just council and not just public health. But the public health things that we're really focusing on, I mean, even just list 5 is tricky for public health on its own. But some of our key priorities are obesity, our substance misuse, tobacco, some of those classic public health ones that we often need to be really focusing on. But substance misuse is really high priority now, because there's a lot of work there on the national drug strategy. Obesity maintains priority, mental health, tobacco, and a lot of the working with the NHS around some of their core priorities around primary prevention, so screening, cancer outcomes. So it's difficult to distill it down to 5, but it is that whole system working that this is highlighting. So not just public health focus, not just council focus, but the whole wider partners as well.
I don't think I was suggesting for one that is council that has all the answers. I think the NHS and all the other factors are just as important. But what I am trying to ask you is that as a statutory part of the public health, what is it that we can do for those specific targets that we agreed some years ago, where we were trying to say, for instance, what as it used the example of life expectancy was getting closer between men and male and female, as well as some of the areas of deprivation where there was a huge gap. It depended where you lived. Your life expectancy was, as such, that there was a gaps within the town. We're not talking about, even Barton or closer villages or something, or another town, but I'm talking about within the borough boundaries of Luton. So we started some initiatives. What I would like to see is that if we can sometimes put it on our work program, where you can come back and give us some report in terms of the major issues, be that may, whether it is the respiratory diseases or the diabetic or the other things, or all these things. Is such a wide range of information. If we can get a very small number of things where we are working, and an example I give you, but some years ago, when we first introduced the fruit in the schools, that had a major impact in the children's health. At first, everybody was, oh, how the hell, who's going to clear all the mess the children will make? But they have been using that, and schools have been providing that for years, and it had a positive impact. So some small initiatives sometimes have a major impact. So how can we do? We don't know. We haven't got a huge fund ourselves, but working with our NHS colleagues, screening of, say, for instance, number of, I think, whether it's in cancer or whatever, it does help if the screening can be improved and less people can get a treatment at the right time. That has a huge impact in terms of, your health. The later you leave it, the things get worse. So if we can, please, we get some information which is probably manageable for us, and we can see the progress. This is what we've done. This is what we have. Yes, I agree. By 2040, no one should live in poverty. But that is a very long term. I'm looking for a short term, which we can see between 3 to 5 years.
So can I just come? I've seen Mark's got his hand up. I'll just come back in on that. One of the things that we have been talking about within the public health team in the last couple of months is that when we do our annual public health report, obviously on an annual basis, which is a statutory requirement on a deep dive on a particular health issue or topic, that we actually also do a 2-part report going forward that also has a public health impact report on it. So we can do exactly what you've been saying, where we say for our tobacco strategy or our stop smoking service, going into even more detail, or our screening outreach programme, this is the impact that we've had by numbers, and just give a bit more of a by numbers narrative on an annual basis. So we'll start that next year. So I think that would help do some of that tracking on the smaller scale projects. But what I could look at doing is looking just in the last, obviously we've had COVID, so it's sort of thrown a bit of a spanner in the works on the longitudinal data collection stuff. But for the last, say, 3-5 years, some of those projects that we started, it would have been started before my time, but where we've continued through working with GPs or NHS health checks, for example, what actually has been the impact. And we've done a health equity analysis on our health checks recently. So we could bring back something that just shows some of the impact of those sort of 3 to 5 year timeline programs that you've probably seen come through here some time ago and haven't seen what happened at the end of them. So I could do a pick a few across the life course, some children, young people, some primary care, some wider system ones, and do a bit of a what actually happened and what was the impact on those. Would that be helpful?
Yes, that would be helpful.
Yeah, that'll be very helpful, Sally, because that's what we're really looking for. I think all the members like to see, where initiative which has made it, be that may a small difference, but it certainly has done in terms of trying to improve the health of the people of Luton. So that for us is a huge thing. I'll come back to you on the other question, but other people may have some questions too.
Mark, did you want to come in there?
Well, just briefly, I think Sally sort of picked it up from a slightly different approach, Chair. And firstly, let me apologise for not being with you all tonight. And I just couldn't be on site, unfortunately, today. So as Sally said, look, what the JSNA reflects is a very difficult period of time for the country nationally with regards to cost of living, COVID and what we're coming out on. And then the JSNA is a reflection of where we are as a borough. But I completely agree with Mahmood. Myself and Sally were in a meeting today about health inequalities and what we're doing and how we're approaching these things in a very pragmatic way to improve outcomes for residents in Luton. So I think we're all obviously very much on the same page. And I think Sally's framing of looking at particular groups of individuals and what we're doing around that can be something we'll take away and consider. From a Scrutiny perspective, it might also be that you'd like us to bring something back on particular headings. So our approach to drug and alcohol, obesity, smoking, sexual health, vaccinations, if there are things that Scrutiny would like to see with regards to our approach from a council perspective, but also a system-wide perspective, that might be something we want to think through. Especially there's a lot of work going into particular areas that it might be helpful for Scrutiny to see, comment on, and help us as we work forward on these very, very difficult subjects.
Thank you, Mark. Personally, I think I'd like to see that sort of thing done for the whole of the mental health side of things, if that's possible.
It certainly is. There's a lot of work going into mental health, so we can pick that up. Is there anything else you'd like us to focus on? I'm just thinking of the rest of people in Scrutiny tonight, so we can pick up mental health. If we were to have 2 or 3 subjects,
Is you gave a list just then. So 2 or 3 subjects from that list, or
yeah, I know it's just a thought, Chair. Really, nothing more than that, because I understand where the councillor is saying Mahmood's coming from, in that what he's saying is what is the borough doing to change these outcomes that are very concerning for us all at the moment. And what I'm trying to do is sort of offer confidence, because I know the team is working incredibly hard in particular areas. And I think by way of good governance, it would be helpful to share some of those, some of those passages of work. So drugs and alcohol, there's a lot, obviously from a town centre perspective, a system-wide approach. Sexual health, we've got large contracts that we're working on and seeing some really positive outcomes. But working with thousands of residents to improve their health outcomes, particularly, but even especially with a lens of inequality.
Okay, so yeah, yes, I think we should be focusing on those areas which are going to have the most beneficial effect for the largest number of people when we're talking about health inequalities.
Okay, fantastic. So if it's okay, Sally, we'll do sort of mental health. We're doing a lot of work in that space, drug and alcohol, and the sexual health tender and the approach to that space. If we could get them on the forward plan and just bring something back.
If there are any other views from members on this at the moment? Yes, Councillor.
Yeah, I'm a little bit concerned about the percentage of children underachieving in comparison to the rest of the country. It says 56.6%, and in comparison to Birmingham, it's 62.7%, and to the rest of the country, it's 65.2% at the end of reception. Can you tell me what's being done or how we're trying to address that inequality there, please?
So a lot of that work will sit obviously with the education team, and there's an education strategy, and particularly looks at gaps in attainment. So I can't talk to the detail of it, but I know there is a lot of work underway. There's a particular inequalities strand of that work programme, that's being picked up through the education team.
Okay, thank you. Because obviously that does have a big negative impact onto the secondary schools when it happens. And I know we have quite good Progress 8 scores, and I know our secondary schools do a marvellous job in turning our students around. But if we could give them a better start going into secondary, of course, that would be wonderful.
Is that something that would that's come before Children's Services?
I think it's probably come to, apologies, I think it's probably come to Children's Scrutiny. Sorry.
Councillor Hussain, then Councillor Arles.
Only I'm going to say that tomorrow night is the Children's Services Review Group on Education. So these questions are relevant to the colleagues tomorrow. If you want to come and ask those questions, all the relevant people will be here tomorrow to answer your questions.
Okay, thanks for the report, Sally. I think it's very good, very comprehensive. I'm just concerned about the total school absences and the persistent absent rate as well, because obviously it says total absent rate in Luton is slightly higher than the national average, and then the persistent absence rate in Luton is higher than the national and regional averages. And obviously you said that obviously there's a board tomorrow, but I'm just concerned and what's been done about it and what measures are taken to, to lower this rate. Because if it's persistent, that means it's obviously been ongoing for quite a while. Thank you.
Is this something else that should be coming before Children's Services rather than?
Probably, yeah. But yeah.
Councillor Nissa.
Yeah, my concern is about accommodation. I believe that, all health issues, everything, there is a link on accommodation. There are many families on waiting list, and also some on the temporary accommodation, which is not enough in Luton. Recently, we heard that there are more than 550 families. They came to Luton from abroad with the human rights. So, I mean, how this is going to be looked into? Thank you.
So again, I don't have all of the detail of what's happening, but I know so that the JSNA provides that evidence base that then that team can take forward to help inform what they're doing. And I know the housing directorate are looking at that in detail. So I don't have all the details, but I don't know if Mark has more to share in that space, but something could be brought back here on the link between housing and health, but I don't have the details of what actually is happening there.
So, Chair, I'm happy to just step in a little bit. I mean, I haven't got all of the detail, but I've got certainly covered. We've got something coming to policy group in October, that we can share more widely after policy group as well. And that's what's happening with regards to the pressures we're experiencing in temporary accommodation across the borough and what the drivers are for that aspect as well, and what we're trying to do to work with families earlier in the system to help them not come into temporary accommodation. And if they do, how we can help them move on constructively in a positive way. But it's not easy or straightforward. And what we haven't done is broken that down with a particular health lens. So again, by way of the forward plan for scrutiny tonight, health and social care review, I could look to put something onto a forward plan that we can get into more detail. So post the policy group, the general policy group in October, we brought something back with a health lens in November, December. And just by way of the number of families I know that we've got that are sort of like considered for asylum, it's more like 1,200 families now, not 500. So we are very much disproportionately impacted than any other sort of like the surrounding boroughs and comparable authorities as well. So it might be a particular lens in the JSNA about the 500, if that's the reference in there. But I know the up-to-date information from the Home Office is more in a region of 1,200 families.
Yeah, thank you for that, because we have, constituents coming to us, regularly. They're living in, crowded family, 8 to 10 members in, 1-bedroom house, which the living room, they also count as a bedroom. So, it's the health, and then there was domestic violence due to that, then health issues. So everything links to that.
I completely share your concerns, and without a sensible housing offer, people's health and long-term health are definitely impacting. We understand that, but again, it is a reflection of actually what we're trying to do under some very difficult circumstances in Luton. So it'd be helpful from our perspective as officers, as going to policy group and then coming back to health and social care scrutiny maybe a couple of months after that as well.
Yeah, I think that would be appreciated, Mark, as long as it is through the health lens, as you say, because otherwise it should be an OSB matter.
Yeah, no. So this is a particular sort of, as I heard, the reference was about families and their impact and the duration of what they're in and what we're doing from a health perspective to work with them. So I'm quite happy to frame it in that way.
That'll be great. Thank you very much. Thank you. Councillor Ali, please.
I'm sorry, I'm going to ask something, but I missed the last item, so it might have been answered then already. But I noticed that the physical activity levels are lower, obesity and diabetes prevalence higher. What are we doing about that? And is that something that you've agreed to report on anyway? Because I know that was something to do with the previous one. Sorry, that's my fault for being late.
So the previous item was around planning and licensing and fast food outlets and the impact on obesity. So that item was agreed to come forward, focusing on the planning process and licensing and what's happening there, but recognising the impact that it has on health and our obesity strategies. So we haven't completely covered it. So yes, physical activity and obesity are big priorities for us, and we have our refreshed physical activity strategy going out to second round of consultation. But in the meantime, we're moving forward with the governance of that and have the work streams that are up and running for that. So really looking at that system-wide approach to increasing physical activity. So increasing access to sort of day-to-day physical activity as well as sport. So having both sides of the coin as part of that. So there's a lot of work happening there. And then linked to that, we've got a broader healthy weight strategy that we're refreshing, and we're planning to have a healthy weight summit in the new year, which is all partners coming together to really re-energise the actions that we should all be taking to address obesity, improving healthy weight in the borough, because it really touches on so many people's areas of work. So it's a real multi-partner strategic direction that's needed. So think about early years and schools and planning and built environment, and sort of building physical activity in day-to-day lives. So access to walking, safe walking, feeling safe, all of it, it's such a wide-reaching topic. So we're holding a summit on that in the new year, but in the meantime, refreshing the plans around that. We're also looking at a refresh of what we had previously was a food plan, but building that into the healthy weight strategy that I've just talked about. So thinking about healthier fast food. I think there was an initiative previously called Tuck In, which was about having that healthier option within fast food outlets, education around food in schools, all of those kind of access to green space, to growing your own activities that, there's pop-up things around that in the borough. So it's all lots of strands of work happening in that space, but we're going to culminate that in a refresh and a big event in the new year, to move that forwards.
So the healthy weight strategy, is that going to come to us at any point, or is that a policy group, or?
So the physical activity strategy has gone to policy group in terms of going out to consultation. So that's one arm of it. And then there's the food strategy part that will also go through that route. And the overarching bit will be, there'll be always threads of the healthy weight strategy. And that can definitely come here at the right time. I'll need to go back and check the timeline with the team, but I know there's definitely this event to help shape it all and how it all comes together in the new year. So the timing might not be for a little while, but it can come here at some point during that timeline. Absolutely.
Yeah, I think it would be useful for something about that to come here during the process of it, maybe.
Yeah.
So we can give our input.
Councillor Hussain, did you want to?
I think lastly, I would ask Sally if we can, from our colleagues from the NHS, if they can report back in terms of the initiative they have taken, or what they are particularly in terms of the screening, respiratory disease. What are they doing in terms of bringing those one where we are far below in terms of the national as well as our SIPFA neighbours? So can we get that report back? And also in terms of the investment that we have made, be that may small, the initiative that we have done in the last 3 to 5 years, what difference have they made in terms of improving the quality, the health of the people of Luton, or the quality of life, and B, are we continuing with them? And in terms of the smoking one, I think the numbers were going down, and I believe they're still going down. I'm not too certain about that. And those that have a major impact in terms of the health of the children, which specifically, if we can come back with some initiative that public health with the schools, and with, you just mentioned a few minutes ago, in terms of the food that are provided by the school, because some children, that is probably the only healthy meal that they get. And that would be really fantastic if we can do at least that the child get one decent meal a day, because some children are even afraid to go on holiday because they wouldn't get a decent meal. I've heard that, not by somebody else, as a child saying to the teacher, because he didn't want to go on holiday because he wouldn't get a decent food.
Councillor Arles?
Okay, the section on the population wellbeing, infant mortality and child mortality, the rates, it hasn't changed in 3 years, and it's significantly higher. So that is a major concern. Sorry, that is a major concern, the infant mortality and the childhood mortality. Just like to see what is actually being done, what initiatives the NHS are doing to actually try and alleviate this and try to reduce it. And what section of the community, or is there a particular section of the community that is affected more than others? And then what they are doing when this happens, what support is being given to the families when this happens, because it can have a long-term effect on the whole family. Okay, thank you.
Yes, we can bring something back on that. There's a few pieces of work around, there's one particularly working with hospitals on preconception pathways that's relevant to that, and maternal risk factors. So yes, we can bring something back on that.
Thank you.
Councillor Hussain?
I just want to make a comment, actually, it's not a question. So if I'm wrong, if someone knows, just correct me, because I've read somewhere in the report that health-wise is 4 areas like Vauxhall, Stopsley, Barnfield and Birmingham are healthier than the other area. And also poverty is mostly very worse in Farley and Dallow. So when you look into these things, that actually shows that, and these areas are low income. Yeah. So that's why. So is in this case, I mean, it shows the poverty needs to be actually first eradicate. That's we need to look into that, how we can improve the life of people there. And when it's also linked with obesity, which is the takeaway, and most if you compare with the other area, all the takeaways are in all these areas. So we have to think about that as well. Thank you.
Thank you. Yes, absolutely. No, you're completely right. So if you look at most health indicators, there's a direct trend related to poverty. So most health indicators will be worse if you're looking at poorer areas, unfortunately, which so things like smoking are more prevalent in poorer areas, which then also exacerbates that health inequality. So it's more prevalent in poorer areas, but then also impacts even greater on health outcomes. So there's a lot of interrelated things between health behaviours and poverty, and health outcomes and poverty, and accessing health services and poverty. So there's a lot of interrelated issues as to why people who live in poorer areas are more likely to have poorer health outcomes, and why a lot of things that you wouldn't necessarily say are health indicators are in this joint strategic needs assessment, because it's all very much interrelated. So, having a good job means that you're more likely to have better health, not just having more money, but also having better mental health means you have better health outcomes. So there's a lot of interrelated issues, and you're absolutely right, and you're more likely to be obese if you're poor, in very crude terms. So you're 100% right, and which is why all of this is so important, and all of these conversations are so important.
Thank you. Pat.
It's not Sally's area, but Sally mentioned walking, and I live in North Luton and I walk frequently, lots of times, and lots of the paths in Luton are unsuitable to walk on. Grasses and sides have not been cut back. Paths are overgrown. If you're like me, you walk your dog might get scratched by brambles and stuff. So it's all very well saying walking, but other areas like parks and stuff need to make walking areas suitable. Because families can't walk on paths because they're so overgrown. You have to walk in single file.
Thank you. Yes, parks are, so the physical activity strategy that I mentioned, the work stream about encouraging active environments, parks are very much engaged with that work stream, and should be feeding that type of conversation into that. So I think if there's specific examples, we need to feed those into the parks team, but parks generally are very linked in together with our physical activity strategy and the team that are leading on that.
That seems like a very simple day-to-day thing to be able to sort out, but just to get the paths in reasonable, usable order, rather than and obviously it feeds into the into any well-being strategies, but that just seems like something that should be done on a day-to-day basis to keep paths clear.
Yeah, I think that if there's specifics, they could be fed into work. You can email them to me in the first instance, and I'll pass it on. I'm not promising it'll get fixed straight away, but it's good to, if they might not be known about. So if you feed that directly into me, Pat, and then I can feed it into the right team.
There seems to be less, I don't know if it's since COVID, but less grass cutting, less cutting back of verges and things across Luton. I would say I live up by the hospital. Anywhere any of the paths north of Luton, north of the hospital, going from Lucy Farm through to Marsh Farm, Bramingham. They're all overgrown, all of them.
You could perhaps get in touch with your councillor about that. Councillor Ambien.
Good evening. I'm referring page number 86 and 87 regarding vaccination rate for 2 years old children. I compare to other neighbors authority, and Luton vaccination rate is lower. Is there anything, especially MMR and hepatitis B and other vaccine? Is there anything you council take any initiative to raise awareness to the parents about the vaccination? This is on page 86 and 87. And
yes.
And also I got a few other questions. Let me, and also I can see page 88 about dental issues. I know dentistry is very expensive and very hard to reach for NHS referral to the free dentistry. So is there anything council? I know you run health checkup clinics. Is there anything you can focus on more work with dentistry professional, have a kind of awareness about eating habit, changing the eating habits, or work with this trading standard to to stop people having a line of buy sweets from offline, like kind of raise the awareness about to maintain the healthy dental health. Thank you.
Yes, so dental health, as you rightly suggest, is really interlinked to the healthy eating strategy. So colleagues in my team who work on the oral health agenda are also linked into the food strategy agenda, because there's shared messages that we need to have across the two. We'll be doing lots of work in the oral health strategic plan that we have, for particularly focusing on under 5-year-olds, particularly during COVID. So those that were sort of under 2 during COVID and are now still under 5 but still very young, haven't accessed dentists for one reason or another, haven't had their first appointment. We're seeing increasing challenges around oral health in the under 5s. So we've been putting on pop-up clinics and various other outreach pieces of work, but recognising that it's not a long-term solution. So through that approach, we're trying to actually get people to book into dentist appointments, book into dentists as well, and sort of break down those possible misconceptions that there isn't any space in dentists. So some obviously aren't taking bookings, but some are. So trying to navigate that system with parents, but also do education as well around toothbrushing, when and how, and some of that wider education around oral health. So we are doing a lot there currently, but also need a more strategic conversation around the right dental access in the borough. So it's now commissioned by the Integrated Care Board. So need to have a bit more of a strategic conversation around making sure that we've got the right access in Luton for dentistry. And I think because it used to be commissioned just by NHS England, and having it a bit more local now, so it's at BLMK level, gives us a bit of a better conversation that we can have around dental access. So I'll be picking that up over the next few weeks. And then vaccinations, similarly, obviously it's a core statutory responsibility within public health to influence and have that health protection approach, because obviously if vaccination rates drop too low, then there's an increased risk of spread of infection and outbreaks of infectious diseases. But that said, we don't commission the vaccination programme. It sits mostly within primary care, commissioned by NHS England. So it's a bit of a challenge to make sure that we can influence it in the right way. But we've been working with primary care colleagues around pop-up outreach MMR. So when we still had the health hub in the mall, we were doing some work, doing catch-ups for MMR, working with primary care there to try and increase rates. And we have just in the last year seen an increase in uptake of MMR, which is really positive. But we continue to work with the ICB and NHS colleagues on that and see what more we can do. We just had our health protection board last week, actually, where we were talking about what more we can do to increase uptake of vaccinations. We do historically have low vaccination uptake in Luton. And we did a lot of, you'll remember during COVID times, we consistently had lower than national rates of COVID vaccination uptake as well, and had to do a lot of work around communicating the benefits and overcoming some of the myths around vaccination. And it does continue to be a challenge in Luton to ensure that we have the right vaccination uptake.
Pat?
I know it's about a year ago and things have changed since, but Healthwatch did do some research on dentists in Luton, and there was only actually one dentist a year ago but there was only one dentist in Luton that was taking on new patients. So if people hadn't been to the dentist in the last couple of years in Luton, and if they weren't registered one, they weren't taking on new patients. And I know that has changed recently, as you said, but I think it's still an issue in Luton where people can't get a dentist.
Thank you. Anyone else? Okay. Thank you very much, Sally. Okay, so let's go on to the next item, which is the upcoming work programme. Does anyone have any views on the upcoming work programme? And we've obviously discussed a few things that we would like to see coming up. And we have the obesity report on licensing and planning.
Also, just to know, at the next meeting on the 24th of October, we've got a new item from Bedfordshire Hospitals NHS Foundation Trust about the development plans for vascular services.
Thank you. Councillor Hussain.
Can I ask you if we can have a report, please, on the next one, because this is something that's come up, a very recent issue where there was a press statement, which I don't know a huge amount about, that the hospital has cancelled the programme for the helipad and that they are not going ahead with it anymore. Now, people of Luton and other people surrounding area had, did do a lot of charity collection, and I think they got about 2.5 million to 3 million. Now I believe they have decided they're not going to go ahead with the helipad anymore, which has, I myself have a personal interest, because if it wasn't for an air ambulance, I wouldn't be sitting here today, because I had a massive heart attack in Chelmsford, and it was the air ambulance that took me to the Basildon Hospital that I'm here. Otherwise, I wouldn't have survived. So I think it's such an important issue, and I think we need to get the Chief Executive of the L&D, David Carter, to explain to us why is it that they are not going ahead with it when public have generously contributed toward the building of the helipad. And a huge amount of, from my understanding, huge amount of construction work has already gone into creating that facility. So it was in the press, and it certainly is true that they've decided not to go ahead with it.
Thank you, Councillor Hussain, for disclosing your interest. And I think that is something that we will follow up with the...
I mean, Nikki is coming here. Nikki is from the BLMK, and they can tell us what is it that made them change the...
Okay, so we would need to find out who is responsible, whether it's the
Yeah, please.
BLMK.
I think as an urgent item on the agenda, please, for the next one. Yeah.
that will be followed up.
Yeah, thank you.
And just to mention that the Dennery report on health inequalities in the BLMK region is due. That will be someone will be reporting on that to us in an upcoming meeting. Sorry, I believe it's the BLMK commissioned a report on health inequalities within the BLMK region, and that's the Denny report. It's on the BLMK website for anyone who wants to have a look at that, and someone will be reporting back to this committee on that report, on the results of that report. Okay, if there's nothing else on the work programme, I think we can wrap up the meeting. Thank you everyone for attending, and have a good evening. Thank you.